Good afternoon, and thank you for joining us for this community update, a open conversation that we are having with some local doctors. My name is Eric Marsh. I'm Executive Director of Whitewater Community Television in Richmond. Joining me today, Dr. Thomas Huth, who is Vice President of Medical Affairs for Reid Health, Dr. David Jetmore, who is Wayne County Health Department Public Affairs Officer. Did I get all of that?
No, I was really disappointed in your delivery, Eric.
Were you?
It's Wayne County Health Officer.
Wayne County Health Officer.
Yeah.
Okay, I'm sorry. All right, we
sure
have to
you'll
start
do
this
better.
all over again. No. And we're going to spend the next hour not clowning around, but answering your questions. I've had a chance to talk to both of these gentlemen who have been incredibly generous with their time over the last few weeks. But it was important to them, actually, that they be able to provide the community some information. And the community in this instance is not just Wayne County. Reid Health is a regional healthcare provider feeding in a number of different counties. So I believe that we may be on down in Fayette County on CTV3. We are on Facebook Live, so if you have friends, family who you want to see this, you can find us there. We are taking your questions on our Facebook page. You can also send us a question through Twitter at WCTV Info, and we will get to as many of those this hour as we possibly can. And we are really interested in your questions. I have one that was sent in on this piece of paper that I have, and beyond that, I don't have one, so this could be a very short conversation. Let's get to this one, and then hopefully while you're answering it, we'll get a few more. This came in on Twitter yesterday afternoon. If the federal government decides to reopen America before healthcare experts tell us it's safe, what options are there for our community to continue to try and slow the spread of the virus? This is very similar to a question that Governor Eric Holcomb got asked yesterday at his press conference. It's one that I had a chance to kind of ask Mayor Dave Snow of Richmond when I talked to him on Monday. As you all have a chance to talk to the local officials, are they kind of driving this, or do you all feel like as healthcare professionals, you all are driving this conversation and they are taking the advice from you?
Well, I think, I would say, just speaking for me personally, that it has to be a dialogue, that it has to be the right balance of what's best from a clinical, epidemiologic, public health point of view, but also what's good for the state and the nation from an economic point of view, because it's certainly true on the one hand that we have to continue to utilize good practices and protect the most vulnerable people in our community, utilizing every reasonable step to do that. But on the other hand, we can't shut down the economy indefinitely over this, and we can already see some of the economic effects happening, large numbers of jobless claims coming in, and those are probably only going to multiply, business closures and such. And that has long-term negative consequences for people directly as well. So where that balance is, I don't know, but I believe strongly that the governor, the president, all our political leaders are trying to engage in a reasonable dialogue with the health leaders and figure out what's the right exact pathway to take that will, to get the economy rolling again, but also protect the seniors, particularly in our community, seniors and people with chronic health conditions who are most at risk from the complications of this disease. And to me, if the political leaders, the government leaders, decide that it's time to kind of, and maybe in a phased fashion, get the economy rolling again, start opening some businesses, get people back to work, then what I think we need to do from a health care point of view is continue to, in a sense, reverse isolate the most vulnerable in the community. And I'm thinking of people like long-term care facility residents, where they're already the most buildings across the country are pretty much locked down and not taking visitors except for very urgent matters, and really have intensified their infection control practices. That won't change if the economy begins to open up. And then there are people who really should spend more time at home and still avoid going out into social circumstances for their own protection. Right now, everybody's trying to stay home to help prevent, say, the younger, less vulnerable from causing infection in the people who are most vulnerable. But, so I can sort of foresee a future where it may be in a phased way we're getting the younger, the working type of folks back into the workplace in some kind of a fashion, but still practicing good practices like social distancing and hygiene practices. And those people still have a responsibility to intentionally modify their behaviors to avoid, where they can, potentially accidentally contaminating or causing infection in people who are more vulnerable. And then on the other side of that, the more vulnerable continue to have to practice self-isolation techniques to protect themselves. That's sort of the way I see it playing out, but that's just my own personal view of the matter. And we'll have to see what happens. And Dr. Jetmore might have a different impression of things, coming at it more from a purely public health point of view. And so I'd be interested to hear his thoughts.
Well, this is bitter medicine that we're having to take in order to control this virus. And the decisions to close restaurants, the decisions to close barber shops, hair salons, these were not taken lightly, and they're difficult decisions. But I have to say, Eric, that our leaders here in Wayne County, the commissioners, the city council, the mayor, their decisions have all been guided by the public health department. All these difficult decisions, no one wants to shut down an economy, but the alternative is to let this virus rage throughout society. So I think at the present time we're doing all the right things. In fact, we're doing almost everything we can, except to bring the workings of our society to an absolute standstill. So we're doing the right things now, and I think that's bearing fruit. I think we're having a much slower growth of this virus spreading around than we've seen in other parts of the country, where people acted later than we did in Wayne County, and for that matter, the state of Indiana. So, but I agree with Dr. Huth, when we get to the point where the numbers are falling instead of rising, and we start wanting to open up our society and our businesses again, it needs to be done in a gradual fashion.
You're watching a community conversation on Whitewater Community Television's WGTV Channel 11. We are taking your questions on our Facebook page. We're also taking your questions via Twitter at WCTV Info. You have, Dr. Jetmore, no problem telling me when I may have overstepped. Last time you were here, we were talking about masks, and you made it perfectly clear I didn't need one. We've told people to wash their hands. So you'll tell me live on TV when I'm wrong. So cool.
Well, you could do the same to me, Eric. I mean, this is a fair exchange here.
I would not. Before you all came in here, we had our state representatives in here on Wednesday afternoon for a live conversation with them. Before I let you all in here, I came in, I wiped down the microphones a little bit, I wiped down your chairs. We've been telling people to wash their hands. Before I got in my car this morning, I took cloths out, I wiped the inside of my car seats. I've been driving back and forth, and I've obviously been out in the community. How much is too much and how much is too little? What do we really need to be telling people about what kind of protections they need to take?
I think the most important thing is social distancing. If you can stay 6 feet away from other people, you're going to go a long way into not contacting this virus, which in an infected person can be spread through a cough or sneeze, in droplets hitting your face or you're breathing in. So as far as, the other factors are touching a surface that has the coronavirus on it and then bringing it up to your mouth, your eyes. I think every time you have a chance, it's good to wash your hands and spend 20 seconds doing that. I don't think you have to have a fancy hand sanitizer. I think good old soap and water will destroy this virus. The shell of this virus is mainly made of lipid or of fat, and we know what soap does to fat. It just emulsifies it, it destroys it. So washing your hands, avoiding others, and commonly touched surfaces like banisters, doorknobs, countertops, wiping them down with a disinfectant. That's going to keep you safe.
If you're doing that in your home, how many times a day? Once a day, twice a day? Is there a feeling, because people don't know. We're telling them some basics, but
I think your home's starting at kind of at ground zero. You don't have any coronavirus in your home. So I think that the times you do that are when you return to your home from the outside. You may have some additional thoughts on that, Dr. Huth.
Well, I mean, I agree with everything you've said. And I can tell you that in my home, simply as a kind of reminder to me to kind of get me really drill deep into my subconsciousness, the need to very frequently wash hands. I have my Amazon devices set to remind me every hour to wash hands. And my wife's probably watching right now, and she might be embarrassed for me to say that, but that's what we have set up. And so I think that sort of thing, to your point, inside your own home where you know you've got things sanitized, that's probably less risky for you because that's where you already spent time and that's not making you sick. But we happen to have some extra reminders set up for us to do that frequently. And I think more people could maybe do something like that to remind themselves, particularly when they're out in public, anytime they're interacting with commonly touched objects like hand railings and doorknobs and countertops and the like, to wash hands or at least use hand sanitizer if soap and water isn't available. And I agree that we prefer soap over hand sanitizer, but hand sanitizer is a good idea if you don't have access to soap right away. There has been scientific information circulating around about how long the virus persists on different materials. Mm-hmm. And the thought is that on hard surfaces like even stainless steel and plastic and countertops like granite and the like, that it may persist up for a number of days. And that has to do with the way that the virus, unique characteristics of the virus. Many other bacteria and viruses rapidly dehydrate and die, but the coronavirus seems to have the ability under dehydrating conditions to actually go into kind of a dormant state and persist for longer. And so it's one of the many characteristics of this virus that are particularly unique to it and that we need to take into account when we're interacting out in public. So
people have asked me in relation to how long this virus lasts on surfaces. People, of course, are getting boxes in the mail and from Amazon, and they're wanting to know, am I going to handle this package and pick up this virus? But for whatever reason, Dr. Huth may know, but the virus only lasts for about an hour on cardboard. So you're much less likely to get this from a package which is usually spent more than that time in transit.
I think that the CDC released some guidance really just in the last 24 hours or so on that topic. And they said that most packages, because some people are worried about packages that ship from China, put that in, you have to have that context. But generally, packages that come from China, once they leave the origination point in China, aren't handled by people often for several days. And then once they make a port of entry in the U.S., it takes a few more days for them to get to us. And so those are probably among the least risky surfaces to worry about. It's really more about the common everyday surfaces, a waiting room and in a government office, these kind of, chair rails and so forth. Those are the kinds of surfaces we need to be more concerned about, and hand sanitize frequently when we're out in contact with things in the public.
You're watching a community conversation on Whitewater Community Television's WGTV Channel 11, also on WCTV Channel 21. We're with Dr. Thomas Huth and Dr. David Jetmore. There's a question: what can and is being done for pregnant women, especially those who are 36 weeks or more?
Dr. Jetmore probably has some thoughts on this, and that's something that at Reid we've been intensely studying because we want to make sure our workforce is safe, and we're the largest employer in the county, over 3,000 employees, and of course there are a number of pregnant ladies amongst the workforce. There isn't a lot of data right now about the impact of the virus on pregnant ladies, and you can find anecdotal reports in the scientific literature that are kind of on both sides. It's not as big of an issue as certain other viruses, but maybe on the other side of it there can be some impact. The truth is we're probably not going to know until there's been enough time to really study large groups of people and have more methodical research into it.
There is a suggestion out there that women who are pregnant are not more likely to do more poorly with the virus than if they weren't pregnant. And I heard this the other night with a gal on TV who's an ER doctor, and she was being interviewed by Sanjay Gupta, and she was 39 weeks pregnant, but she made that comment that she was heartened to hear that if she did get coronavirus, that she would not be more likely to have a worse course than someone that was completely healthy.
I think something that works in these ladies' favor is they tend to be in the younger age groups, which tend to have less severe disease if they do get it. And I saw one report of a number of births in women, and I think it was in South Korean women. They studied a relatively small number of births done during their portion of the epidemic in South Korea, and there really weren't any higher rates of complicated outcomes in those deliveries than in women who had not had coronavirus at the time during their pregnancy. And you can find information, little anecdotal things, kind of on all sides of it. And but generally at Reid, we are sort of intentionally trying to find where we can roles outside of our containment areas for pregnant ladies to work, if that's possible. That's not possible in every case because some folks have scarce skills that we need their assistance with, and in those cases we make sure that they have all the personal protective equipment that we can give them so that they can do their job. But we are sensitive to it and want to make sure we're doing the right thing by the pregnant ladies. But I'm not sure that the average pregnant woman out in the community needs to worry terribly, but should take all the precautions everybody else is doing and maybe try to limit their exposure to the extent that they can because there are unknowns that are still out there that are not resolved.
Normally I hear a voice in my head telling me that we can go on to the next question, but I'm not hearing anything, so I'll just kind of use my phone and go through. Another question: can you have COVID-19 and the flu at the same time?
Yes. Yeah, the one disease does not protect you from the other. In fact, some people have suggested that if we do see a patient with the flu and COVID at the same time, we should go ahead and treat the flu in order to try to lift the load on that particular person's immune system.
Yeah, that's right. Originally when this started, there was a thought that there were not high rates of co-infection, we would call it in scientific terms, but clearly we can have co-infection. That has changed in the thinking patterns, and of course, if you're suffering from the flu and then start having side effects, the severe consequences of COVID, that sort of makes sense that that's not a good combination. So we will want to make sure that we're treating the flu to try to reduce the consequences from the flu at any rate.
Next question. I know healthcare workers that are stripping down in their garages, immediately putting their clothes in the washer and jumping in the shower after work. Should non-healthcare folks be doing the same thing after working in a factory or maybe visiting the grocery, et cetera?
No, I think that's kind of dramatic. I have my youngest son is an ear, nose, and throat surgery resident in Detroit, and he takes, when he comes home from the hospital, he takes his clothes off in the basement and goes and takes a shower. But he's around, he's being around people who have COVID-19, and I think that is a healthy precaution for him. But I think if you're working in a factory or certainly going to a grocery store, and you're following the precautions that Dr. Huth outlined earlier about social distancing, avoiding commonly touched surfaces, I don't think that's necessary. Do you have any?
Right, I agree completely. I think that, I mean, if you want to do it, fine, but that's probably not really a necessary thing as far as we know today. It's a different thing for folks who work in areas where they are likely to come into contact with COVID patients. That's and really, I mean, healthcare workers. Mm-hmm. You could maybe make a case if you're an EMS person, interacting with the public, and you never know what kinds of, you're just responding to calls, and there is very, very limited information about what kinds of issues these folks may have. And you could make a case for that situation. A firefighter who's going to first response on EMS calls, or the EMS providers themselves, EMTs and paramedics and such. If I did that kind of a job, I might be tempted to do exactly what you're suggesting. I can tell you that at Reid we have areas that are set up specifically for the care of COVID patients, and at least in the most intense area, our ICU, we actually provide a shower capability so people can change and leave their scrubs and such there. We would prefer that they do that, and other people may choose to go home and that are working not in COVID areas. I'm sure some of them choose to go home and do exactly that. Just, get out of the clothes in the garage, and that's defensible. There are certain people who maybe should consider that, but the general public, probably not necessary, because your biggest risk is the transfer of virus from surfaces to your face. And so if you don't do anything else, wash hands very frequently is always my advice to people.
And I know I'm not trying to throw my questions in here, mm-hmm. but as a follow-up, does your suggestion on that change if there is a person in the house with a compromised immune system? And since we really don't know how much of this there is actually out there in the community, if you're out, is it not prudent to be safe rather than sorry? Just as a question.
I would never call that imprudent. I think if you chose to do that, that would be entirely defensible. But from a scientific standpoint, we don't really know what to tell people about whether they should. So that's a different thing. Let's never tell anybody, don't do that. If it ever turns out that people should do it, we'd be the first to tell people. But I think we're, at worst, kind of in that middle zone that it's probably not necessary. But if you have a unique circumstance like what you described, then, that would be defensible.
Okay. You're watching a community conversation on Whitewater Community Television's WGTV Channel 11 and WCTV Channel 21. We're also on Facebook Live. We are taking your questions through our Facebook page as well as on Twitter at WCTV Info. We'll go to our next question up. Should anyone wear a face mask who needs to go out in the grocery? I'm going to start with you because you beat me up about face masks a couple of weeks ago.
Well, I think... Well, first of all, I'm going to ease back from my hard line earlier. If you want to wear a face mask, you go ahead. However, having said that, the people that need to wear face masks are healthcare workers that are encountering people that have COVID-19, and the patients who have COVID-19, you are not really totally protecting yourself from the standpoint that if this virus hits your face in a cloud, it's going to hit the mucous membranes of your eyes. And some people argue that this mask is going to become kind of a sodden reservoir of bacteria and virus by the end of the day. And I think one of the other problems is these masks are in short supply. We got, just as a small anecdote, the arrival today of the District 6 goods that we get from the federal government. And normally you need a forklift to unload pallets for this. Well, luckily, this could be picked up in two hands. It was a box of masks and a box of gloves. That was the supply from the federal government on this particular delivery day. So these masks are in short supply, and especially the N95 mask, which are coveted by healthcare workers because they filter out in a much finer manner viruses, and they have a much closer fit with your face, assuming you don't have a beard.
That's troublesome. Masking is a complex subject, and it's hard to boil it down to a few essentials, but I think there are a couple things that everybody can know and understand about masking. First of all, I do recommend that people who have a cough or upper respiratory symptoms, if they're going to go out in the public, yes, maybe that's a good idea to consider wearing a mask, because then, that's the equivalent of you carrying around a handkerchief on your face, so that if you're sneezing and coughing, you're containing the distribution of the droplets and such like. And so that much at least makes common sense. Out in the general public, though, if I want to protect myself from being exposed to a virus in the air that I'm inhaling, it's pretty clear that in general, masks don't add a whole lot unless you're right in the zone of spray of somebody's cough or sneeze. And that's what we're trying to prevent with the social distancing strategy rather than masking. The social distancing is probably much more effective.
It'll accomplish the same thing as a mask.
But on the other hand, and just to know that the typical, even the surgical mask, they are manufactured to certain certified standards, and not quite down to the micron filtration standard that would protect against this particular virus. It's smaller than that, just in terms of the virus getting through. In addition to that, the standard surgical masks don't have a seal around the edges. And so that's why when we have healthcare workers working directly with COVID patients, typically they're wearing the N95 type mask, which is fitted, has a seal, has higher filtration efficiency, and that's the way to get that kind of protection. But out in the general public, me wearing a mask doesn't really add much value because of the filtration capability of the standard surgical mask and the lack of seal. And now, in China and other places, and I think we'll see more here in the U.S., people wearing homemade masks or handmade masks, and I see them being described in different ways as designer masks and the like. But basically, things made out of cloth material. There have been some studies done on the filtration efficiency of that type of mask, and even the best made ones are lower filtration efficiency than the standard surgical mask. But there's a huge variation in the filtration efficiency because it all depends on the materials they're made of, how many plies, exactly how they're constructed. But in no case do they perform even up to the standards of a normal ear loop surgical mask. So, they're really of limited value out in the general public. And I always go back to what's my greatest risk out in the public, and it is contact with surfaces, handrails, tabletops, countertops, armchair, chair arms, and the like. And so the first defense really is the social distancing plus hand washing and the cough and sneeze hygiene. So when we talk about healthcare workers, it's a different world, particularly when we're working close to the COVID-19 patients. And I will say at Reid, in the last 2 days, we've transitioned to everybody, all Reid employees who are even just out in the public areas of the hospital are wearing masks. And that's really more for if I walk out there and I've got a cough or something. What we're trying to create there is as much of a kind of a sterile zone from the doors in as we can to help protect our vulnerable patients and visitors who come in, have to have services and such, and also to set an example for all folks in the organization to be cognizant of their responsibilities to observe the hygiene principles. But I think it's a different question out in the general public along the lines that I described. But everybody's got to take their own situation into account and do what's most comfortable for them. There are a lot of handmade masks that are starting to be made that are being supplied to us and to others. And we think that there are some ways they can be used, not by us taking care of patients except as a very last resort, but really more for instance, the EMS services have shortage of masks, some of them very critically short. And to protect them, those are the kinds of masks maybe they could put on the public that they're interacting with and have to help. Those individuals could wear the mask, the members of public, and reserve the better mask for the first responders to help protect them better. So we see some opportunities like that and others for the handmade masks. So we don't want to discourage the making of handmade masks because they can be put to use in constructive ways, but for targeted situations.
We're having a community conversation. We are speaking with Dr. Thomas Huth from Reid Health, Dr. David Jetmore, Wayne County Health Department. A couple more questions that we have still coming in. Is it really safe to get carry-out or drive-through food?
I think it is, because I do it all the time.
Well,
I must think it's safe, right, Eric?
In addition to that, Dr. Jetmore, your office does the inspections on the dining facilities and
That's
such
right.
like, and make sure that they're observing good
That's
sanitization and hand washing and all of that. So yeah.
Yeah, we have. We're the department that inspects all of these establishments. This is a very hard time for these restaurants, and those that have a carry-out facility. I want to patronize these businesses. I want them to be here when this is all over, and I like carry-out food. So, having said all that, I think the food's being prepared in a good fashion. It's the same food you were getting earlier. The people preparing it are not sick. They're wearing gloves when they put the food together. The package that the food comes in is not a hard, dangerous surface that coronavirus lives on for a long time. I think when you get this home, take your food out, dispose of the paper bag or whatever it came in, and go wash your hands, say grace, and eat your food.
Okay. The next question up. Are the cases that have not been officially tested but having all the symptoms being considered in determining the intensity of the outbreak in Wayne County? Are the cases that have not been officially tested but having all the symptoms being determining the intensity of the outbreak in Wayne County.
Go ahead, Tom. I think
Well,
this is.
We watch the statistics very closely, and Dr. Jetmore and I have a daily phone call with the hospital, with not only the Wayne County Health Department, but virtually all of the counties surrounding us, their public health officials. And I think what's become clear to us at Reid is that the official state statistics say are one thing, but the reality on the ground can be another. And I think, for instance, as of today, the state website that has the state website tracker of the counties affected still has Wayne County showing one case. But you have to understand, and that's true, but you have to understand what that is. That is one case of a positive patient whose home county of residence is Wayne County. And so to put that into perspective, Reid Health is the major healthcare system for this whole part of the state. Mm-hmm. We cover virtually 9 counties, including 2 in Ohio, about 150,000 people, depending on how you count it. And we have a good number of cases in the hospital right now, and that we have seen as outpatients that have symptoms consistent with, but for various reasons they're not able to be tested, or the tests are still pending. And so the state website says one case, and that's because that's all the information that they have. But I think the reality is there are more cases in the county, and Dr. Jetmore probably agrees with this. It's just that they only count the ones that have a verified positive test, and not everybody gets tested. Not everybody can be tested. But we certainly see cases where we're highly suspicious and we treat them as though they are. But you have to understand that there is no specific treatment for this disease. It's not like influenza where you could take Tamiflu if you do within a certain period of time, and Tamiflu makes influenza better. There is no specific treatment like that. There's no vaccine yet. And really the treatment is supportive. And so the testing is reserved for those who have severe disease, severe enough to require hospitalization, and in whom knowing that it's COVID can maybe help with the decision making about the care in their case. And the testing supplies are limited. So they're just not generally available. That will change, I think, with time. So being able to detect all of the cases in the county by virtue of testing is just not going to happen in the foreseeable future.
We need for that to happen. Mm-hmm. That's the one thing that's going to help us get a hold of this epidemic, is being able to freely test everyone we suspect, be able to retest people who we think probably had a false negative. But I think the person who posed that question wanted to know if we were considering this data in terms of how the pandemic is growing, and we are. We see growth each day. We report positives, negatives, and then pending cases, and then another group of people who we're pretty sure have the virus just based on their clinical presentation. They may be on a ventilator, they're short of breath, their CAT scan shows a classic ground glass appearance in their lungs. So we see a slow growth in those numbers, but it's not, I think the things that our citizenry are doing, I mean, the people out in the community are really, there is something you can do about this virus, and I think our citizens are doing those things, and I think we're seeing a slow, steady growth of this, but it's not a volcanic eruption of cases like other communities in the United States are suffering right now. That may change, and I always tell Tom, I mean, ask me something in an hour and my answer will probably be different.
Well, especially when it comes to coronavirus, the information and facts on the ground change very frequently. And I like to say one day in normal time is about 10 years in
Coronavirus time?
times, because it feels like it's been that long. What would normally take 10 years to change in medicine changes on about a daily basis.
Yeah.
Today with respect to coronavirus.
We've got about 20 minutes left. You all are doing quite well. Questions continue to come in. Disinfecting wipes and sprays often say they kill 99% of germs. Is there scientific evidence that COVID-19 falls within that 99.9%, or is it part of that 0.1% that these products don't kill?
No, I would use these products and not worry that they're missing missing a germ.
I don't know that there's been huge studies done on this, but I know that the ones that we get at the hospital have been used in a small Chinese experiment of wiping down, of testing for virus before and after, wiping down with the exact brand that we have, that we use at the hospital, and it totally eradicated any signs of the virus.
Wow.
And they could
I
not
need some of what you got.
detect any. What's that?
I need some of what you
Well,
got.
it's very common. I think it is the most commonly used. So
Okay.
Why don't you name
I don't
that?
I don't know about what's that.
Why don't you name
Because you
what that?
can't get it and you wouldn't be able to get it anyway.
They are getting to be in short supply. The brand we use is called Virex Plus. I don't even know if there's a consumer version available for sure. Probably is, but I know that that's amongst the kinds of things that have been kind of pillaged from the retail stores. I think it's very likely that most any brand of sanitizer you'll find will kill this virus, in my mind, and you needn't worry about it. And if nothing else, mix up some warm soapy water and clean with that.
Yeah.
Okay. Should someone with a health issue refrain from going out in the public, like a store?
Dr. Jetmore, is probably the best person to answer, but I think that's probably wise.
Yeah, I think that's the prudent and wise thing to do. If you if you have diabetes or an autoimmune problem, you're a patient's had chemotherapy, you've got prior lung disease or cardiovascular disease, have somebody else in the household venture out to get food and bring it back to you.
We keep hearing from various places, larger communities for the most part, West Coast, San Francisco, Los Angeles, New York. They're really concerned about being overrun. They're very concerned about short supplies. Talk about, for the general population here, what supplies are like: gloves, masks, things of that nature here. We're hearing that a lot. And space at the hospital. Is there, how is that going so far?
Well, maybe, first of all, maybe as a little bit of context, I'm happy to tell you about the changes we're making in the hospital operation and physical changes we're making in the hospital to respond to the virus, because I'm super proud of our team at Reid Health, who've really stepped up in a very short period of time, really put together a very high-class, effective operation to take care of these kinds of patients. And everybody's gotten very comfortable with it very quickly, and we're doing a great job. There are too many heroes to name in this story, so I won't try, but there are some real genuine heroes who've been working night and day to make this work. We have set up 4 containment zones. One is in the emergency department, and basically it's just a way to take people coming in and rapidly triage at a high level who has any kind of symptom that could be consistent, and run them through the contained area there so that we can have staff work with them with the airflow managed and the proper equipment available for personal protection, just for the triage step. Then in the next level up is we have an area on one of the floors that is, I think today we're using 20 beds for that, but the number, it has been expanded over time. The number may be a little bit different actually. That is for us to cohort the suspected possible COVID cases, but who are not sick enough to be in the ICU. And the staff working in that area are specially trained and prepared to work in protective equipment with those patients. The intensity of service is a little bit higher because it's a little bit more difficult to give care when you're working with the right protective equipment on it. It can be a little bit challenging. I think today the number was 15 patients in that area. Not all of them will wind up having COVID, because most of them are waiting on test results and time to work through what we call the differential diagnosis in medicine, which is the list of possible problems that a set of symptoms might be caused by, and trying to eliminate certain things and work down to the one that is actually causing the problem. That can take time, but in the meantime, we have them in an area where there's no chance of contaminating other areas and making other people sick. Then we have a containment area in the intensive care unit that's about 15 beds in size, and there are 11 patients in there. These are very highly suspect patients who have actual respiratory failure. And this morning there were 11 people on ventilators in that unit, with many or most of the signs and symptoms and no obvious other explanation. A couple of those are actually positive, and we're waiting on test results on others, and and that's a very intense environment where people have to work in even higher levels of personal protective equipment, and the folks who are going in there are really doing a fantastic job, and and like I say, they're really the heroes. Those in particular are the heroes of the story because they're working with the most sick and working really, really hard, long shifts to try to make those people better. And it's a very challenging disease to make better because they can stay on ventilators for a long period of time and have a very long hospitalization. I just can't say enough good about those folks. We have another area that's what I consider to be kind of a step-down area that's only for people who've tested negative, but we don't want to mix them in with the rest of the hospital population in case there's any level of false negatives in there. So they have their own dedicated area while they're in a step-down place before they get discharged. And so now that I've gone through all of that, I kind of forget what the actual question was, Eric, so maybe you can remember me. That's the context.
I don't remember. So I've got another question, so I'll go to that.
I think
Do you
the
remember?
questioner was wondering about supplies in the hospital.
So the supplies.
Yeah, supplies.
Yeah, we have
Thank you.
supply
You're
issues.
welcome.
Fortunately, we actually happen to have fairly decent levels of most of the basic personal protective equipment things. But looking at the rate that we're using them, we're going to go through them a lot faster than we would normally do. And so really the question is not about today's supplies. We're not having to make do or be makeshift about anything. But at some point, we've got to have replenishment of those supplies. And that's difficult now. It's hard to get most of them. Probably the bigger question for us right now is some of the things that are not specifically COVID related, but things that are used in the support of patients in ICU. When patients are on a ventilator for a long period of time, they have to be sedated, receive other kinds of drugs, maybe drugs to support the blood pressure and the like. And one or two of those ancillary support type drugs are in short supply because they've been in short supply from the manufacturers, and now we have increased demand for their use. And so we're looking for alternate sources of getting more of those drugs because those are actually the ones that will run out first. And so we're actively trying to fix that problem.
Okay. We're under 10 minutes. We've got probably 2 or 3 questions here we're going to try to get through, so the answers are going to have to kind of shorten up just a little bit if that's possible. I have no idea what this next one is. If one person in the household is diagnosed with COVID-19, what are the chances of someone else in the same home getting it?
Well, the chances depend totally on how that household handles this. The person who has the COVID-19 should be basically isolated from the other family members. They should be in a bedroom, and that they should be the only one that enters that bedroom. They need to stay in that bedroom 24 hours a day. The food needs to be brought to their door. It's basically social distancing in the home instead of out and about on the street. The person who has the COVID-19 has to be careful what surfaces they touch. Those surfaces, if they need to be touched by other members of the household, need to be cleansed. I think if, and it's going to be a difficult task for the other members of the household, but if people are meticulous and follow those letters to the law, I think that the other members of the family will not be infected.
Okay. I think the next one up is, and it's probably just an estimation, how long are people dealing with symptoms that do not become critical? How long are people dealing with symptoms that do not become critical?
I think that we don't, well, there's variability around this question, but the general thought is that from the time of exposure, the average, more or less the average time to begin symptoms is about 5 days. That's the first sort of time point in there. But there's variation around that. Some people much longer. Typically people have a course where they have more symptoms at the very beginning and then they kind of taper off a bit. And then over the course of 10 days to 2 weeks after that, get better. This is actually the course for the vast majority of people. We talk about the severe consequences, but in actuality, most people have a very benign course, like what I just described. Mm-hmm. But those who are going to have more severe course and complications requiring hospitalization tend to transition to that about day 8 of symptoms. That's the consistent number that people use. So when we have members of the public who are concerned about having it, we tell them to pay special attention to worsening of symptoms beginning about the 2nd week of illness. And that's why we need to stay in touch with them. The health department does. And we have case managers who do that too with folks who come through our clinics. So those are sort of the critical time points.
Okay. We have another question we're going to try to get to, and our time is rapidly going. Does Reid have surplus ventilators if the need arises? That's the one thing we've been hearing a lot about.
Yes, we hear lots about ventilator shortages,
yes.
But very fortunately, we have the capability of supporting, I think the number is up to about 50 ventilator patients. We have the machines capable of doing that. Now we have about 40 regular ventilators, and that's adding to it other machinery like OR ventilators that can be converted to longer-term patient management. And so we are well below our critical point in terms of the ventilator supply. That's not the issue for Reid, fortunately. Probably it's more about, do we have all the staff needed to be able to man that? And we have a plan for basically retraining certain people with ancillary skill sets that can help with that. So we are very confident in our ventilator management capability.
Somebody interested in information about social distancing, what do you think about Alcoholics Anonymous meetings? Should they be virtual? Obviously, we're trying to keep people
away. They should be virtual. And I think when I read something today around the country, these Alcoholics Anonymous meetings are becoming virtual in a lot of places. No matter what the reason for gathering, it's going to help the virus if people gather together. And we do not want to help the virus, Eric.
Dr. David Jetmore, Dr. Thomas Huth, we've got under 4 minutes left to go. I'm going to give you each about a minute, minute and a half. What do you want to say to people to calm them, let them know this will pass, but also reassure them that they're under control?
Well, we will get through this. This is a huge pandemic, but we we will we'll swallow this bitter medicine, and we're going to see cases increase in the short term. They're going to peak, and then we're going to see cases getting reported at lower numbers. I think people always ask me, how long is this going to go on? And I wish I knew the answer to that. And I don't think anybody knows with any certainty. But certainly, I would say at least a couple months yet. And when this, and the economy will come back. Restaurants will reopen. We'll all be able to get our hair cut. So follow the simple guidelines that we outlined here to protect yourself. And we're all in this together. When you prevent yourself from getting an infection, you're not only helping yourself, but you're helping your fellow citizens, because you're not becoming a carrier of the disease. You're not affecting others. So hang in there, fellow citizens. We'll survive.
Well, Eric and I are okay on the haircut front.
I was going to say.
We'll be interested to see what you look like at the end of this, Dr. Jetmore. I would say, we haven't seen the peak of this yet. Now, that's maybe the bad news. That's going to come, and I think the time frames that Dr. Jetmore mentioned are correct. But what the initial flurry of activity has done is really gotten us all prepared, I think. And I'm very pleased with the response of the public. Maybe in some ways things could be better. It could always be better. But, so many people have really stepped up, and they're doing the right things, and we need to continue to encourage that. And we will get through it. We've gotten through lots and lots in the past as a people over history, and we'll get through this too. And fortunately, we live in today's time where there's all the technology and knowledge to really make this go smoothly. I was looking this morning at the case fatality rates, and the U.S. has only about a third the case fatality rate that China had at this point in their upswing in the epidemic. And to me, it goes down from there likely as it did in China. And we're going to come out of this okay.
All right. Dr. David Jetmore, Wayne County Health Department, Dr. Thomas Huth, Reid Health, thank you both for your time. Greatly appreciated. Greatly thank you for coming in and doing this. Hopefully you've calmed some fears and provided some great information for people.
Good. Thanks for having us, Eric.
Glad to do it. We are hopeful that this will end at some point. We have rescheduled our 21 for Fun. It was going to be happening on April 17th. We have moved the date to August 7th. It'll be at the Elks Country Club. So mark that on your calendar, and hopefully we can all be there and really have a good time. Of course, the date for voting has been moved to June 2nd. It had also been extended. The date of registration is now Monday, May 4th, indianavoters.com. Thank you very much for watching this program. We appreciate you being a part of it. Have yourself a safe weekend. I wish you well.